So today I've got the pleasure of introducing everyone to Dr. Liz Fraser, who's a GP in Canberra. Thank you so much for being here today, Liz, and being part of the summit.
It's a real pleasure. Thank you, Tracy. It's a great opportunity.
Awesome. So yes, I just said you're a GP in Canberra, but do you want to tell everyone a little bit more about yourself?
Sure. I see myself as a common or garden type GP. I spend a lot of time in my garden. I'm a hippie at heart. And I guess what's a bit different about me as a GP is that I have a fairly broad perspective on health. So I've got all the conventional training, and we all know that GPs are very good at prescribing medications. But I think what makes me a bit different is that I've had a long-term interest in health and nutrition and food. What I like to do is give people the options and show that there are other ways of resolving health issues or improving health that don't necessarily involve medication. So I think patient choice is important, and I guess my job is to show people what the conventional options are and also show that there are other ways of doing things. For example, changing what you eat.
Mm-hmm. And how then did you come about low carb? I'm very interested in that story.
Yeah, I guess I fell into it by accident in about 2014. At that point, I had a grumpy gut and a relapse of an autoimmune problem. So I went on a gut healing diet. And at that time, I didn't actually understand that it was low carb and healthy fat. And while it didn't do everything that I wanted it to do, one of the things that happened was the farting stopped, and that kept me going.
That's really important.
It was a real bonus, let me tell you. And that was actually getting rid of grain and grain substitutes. And look, I've been really interested in health, and I've 20, 30 years ago, I did vegetarian, and I actually ran a vegetarian restaurant, and, I thought tofu and lentils were healthy, and I did all that stuff. And wow. So I've been through many iterations of, tried lots of different things. And yes, my first experience at low carb helped in some ways, but not in others. And then in 2018, I stumbled across Low Carb Down Under and went to the May gig in Sydney. And what really impressed me then was the science, and that there were people like Dr. Doronscher and Dr. Paul Mason who clearly knew their stuff and had had a close look at the literature. And at that point, I started searching the literature myself and reading original studies, and that got me very excited. And I guess also the basic physiology is something that just makes sense to me. Keep your insulin levels low, and a lot will follow from that. And how you do that is eat real food. It's actually pretty simple, really, in some ways.
Can I ask you, what were the few things that you found didn't help by changing to LCHF? Are you able to share a little bit about that?
It's just some personal issues. It hasn't resolved some of my own symptoms, which is very disappointing. But I guess I keep going because there's other benefits. Like, I come from a background of disordered eating. I grew up with a mum who was chronically dieting, and when I was a teenager, I think I was frankly eating disordered, and that was many, many years ago. And I still live with, I guess, the psychological sequelae of that. And I think one of the benefits that low carb does give me is I feel satisfied. I still feel like I overeat, but I think that's just a layer of headology, which I think many women have. I'm not alone in that, or by any means unique. But what I get is that I'm eating nutrient-rich food. I'm getting what my body needs. There are probably some other problems which still impact on my quality of life. On the other hand, I'm almost 60 years old, physically active, and by and large can do what I want to do with my life, and I feel a lot better than I did 6 or 7 years ago when I was very tired, and I guess my mood was low, and I really had problems thinking at that time as well.
Well, thank you so much for sharing that. It's so important to talk about it, because I think you're right. It is very, very common, and I've seen it, too, in my work all the time. It's something that, is not. I think a lot of women think they're the only ones going through it, but it is not the case. And I think, it's important to talk about it and understand that there's no one size fits all solution. It's such a layering thing, and there's so many other things that come into, how we feel. But, certainly what we eat is such a massive piece of the puzzle, isn't it, in terms of our metabolic health? And,
absolutely.
If we can, yeah. Oh, great. So a little bit about your topic.
Yes. Well, I guess as a GP, a lot of what I deal with are things related to metabolic health and chronic disease. So type 2 diabetes, hypertension, obesity, problems with glucose metabolism, fatty liver is common. And this wasn't the case 20 or 30 years ago. Back in the 80s when I trained, type 2 diabetes was relatively uncommon. And now it's, to coin the phrase, the bread and butter of general practice. And I guess what I was trying to convey was that these conditions are really common, that medication doesn't make us well, and also about how you might have a conversation with a GP about these matters. So if you're someone who's pushing 60, an aging baby boomer, or someone in their 70s who's trying to have a good, healthy old age, and the GP just wants you to keep taking more medication, how might you do things differently? And I guess I was also trying to convey that metabolic syndrome is far more than the 5 criteria, the 5 official criteria. It also encompasses things like arthritis and neurodegenerative conditions and cancer. And that the science is suggesting that by changing what you eat, you can improve, have a healthier old age, I guess, to put it simply.
Yeah, I love what I've heard you say about how, you go to the doctor, most people go to the doctor, they've got, all these sort of conditions, and they end up getting a pill for this, a pill for that. And, it is quite good at the, going to the doctor and getting a pill. But, what you're saying is that, we can unravel a lot of that by looking more holistically and looking at lifestyle and things like that, as opposed to treating one symptom with one pill. Yeah.
Yep, absolutely.
So my last question I'm asking all the presenters is, what's your view on whether low carb is sustainable or not?
Okay, so I've had a bit of a think about this. And I guess the first thing I'll say is, for me personally, absolutely. I find it very easy, but I also know how to cook. So many years ago, I did cook in a vegetarian restaurant, And while I'm now, for probably the last 30 years, have been quite a keen meat eater again, I think you need to be organised. I think you need to have skills. I grow vegetables. I'm motivated. And I think eating meat and veggies and eggs and nuts and cheese and things like that is actually really easy and really satisfying. And I'm in nutritional ketosis most of the time without trying super hard, and that's partly because I'm also physically active. And I guess what is unsustainable about real food? You don't have to be super strict. I guess it depends on what you're trying to achieve. But I think real food is very sustainable and far more sustainable than industrial, agricultural, processed food that's come from depleted soils. I guess another perspective on this is, as a GP, I think absolutely. People talk about the lack of long-term studies, that there are few studies more than 2 years of people on low carbohydrate diets. And I think that's a spurious argument. As Zoe Harcombe is one of my heroes, and as she points out, there was no evidence for low-fat diets at the time that the low-fat dietary guidelines were introduced in the late 70s and early 80s in various Western countries. And there's still no evidence that low-fat diets are any better. And there's actually no evidence that low-carb or healthy fats will kill you. So that's my GP hat. And look, I work with individuals, and I know that not everybody gets it. In fact, probably the minority of people get it. I guess when I start talking with patients about low-carb, healthy fat diets and show them the list of things that they can eat and talk about, cutting down carbohydrates, cutting out the white stuff, you can actually see the look of horror on people's faces. What am I going to eat if I can't eat toast or rice or bread or pasta or breakfast cereal? And I think there's a huge conceptual shift that some people have to make. And again, there's a lot of pedology in this. The talk that I have recorded is more about the why. Why would you want to do this rather than the how? And I trust that many of your speakers will address the practicalities. But I think that there is a lot of fear that fat will kill you, and it doesn't help that we have GPs saying, you can't eat butter, it's going to kill you, or you've got to take this statin, or you're going to die probably next week, which is just not true. So I think it is, for general people, it is sustainable, but they need to think pretty carefully about why they're doing it, what the motivations are, and this is about the work of Dr. David Unwin. He's another one of my heroes in the UK, a GP who's doing this stuff in his very low-key and humble way, helping people find the why and also the how to make it sustainable and long-term.
No, he's amazing. The statin things is interesting. My mother was basically told that. She, said to me, because she was put on statins, she was on so many drugs, she's now off everything now since 3 years low carb at 75.
Fantastic.
Which is fantastic. But when she was first put on statins, she felt it. She said to me, Tracy, if this is how I'm going to feel for the rest of my life, I don't want to be here. It affected her so badly. She was one of the people that really just felt horrible. So, this is when I was starting to look into all of this. So I looked into it enough, and I helped her, learn and get the courage to say, okay, I don't want to do this anymore. But her GP, who's now no longer her GP, I found her a new one, but did say virtually, if you stop taking this, you're going to die, basically. And that is very hard.
I hear this story from time to time from new patients, and I guess one of the things I'm talking about in this talk on metabolic health is how you might have a conversation with a doctor, and also that you might need to be the person who educates the doctor. What I didn't say is that, yeah, sometimes you just have to change your doctor, because some doctors are very set in their ways, and people end up having arguments with their doctor, and then they don't feel safe to go back to that doctor. And that's pretty sad. But I think it's really important to have conversations, you know, with your doctor, and maybe to have conversations with someone who has that broader view, who's done some reading and isn't beholden to the pharmaceutical company version of what works. And look, I'm not, I'd like to get clear, I'm not anti-statin. I do prescribe them. I just don't prescribe them very often. And I keep them for people that are high risk. And I talk about that cardiovascular risk assessment process. But there is very little evidence that statins make significant difference to longevity people who are low risk, and I do believe that they should not be prescribed to people at low cardiovascular risk. And just because your LDL is over 3.5 does not put you at high cardiovascular risk. So in many ways what I'm saying is completely consistent with the Australian cardiovascular disease guidelines. This is not, it should not be controversial.
No, you shouldn't. Well, what an interesting talk you are going to present. I'm really excited to see it, and I'm so grateful to Dr. Liz Fraser for being a part of the summit and for talking to me today. Thank you so much.
Thank you very much for the opportunity, and look forward to hearing other speakers and this broad perspective, the uniqueness that everybody brings to their low carb experience. Thank you.
Absolutely. Thanks, Liz.